Starting Monday, April 27th to Friday, May 1st, member states under the World Health Organization are expected to converge in Geneva to discuss the World Health Organization Pandemic Agreement adopted in May 2025, which was designed to strengthen global pandemic prevention, preparedness, and response. However, during this meeting, civil society organizations in Uganda are calling on all WHO member states to demonstrate leadership, uphold fairness, and deliver an agreement that prioritizes people over profit and equity over exclusion in pandemic management.
Voices came out and saw that there was gaps in it, and part of that gaps was that the developing countries where samples for vaccine development were not considered in the agreement.
We need equity around pathogen data, products that come with the pathogen data, that we need equity in vaccines access, we need equity in diagnostics, we need equity in technology transfer.
According to Henry Magala, the country programs director at AIDS Healthcare Foundation, without rules governing how pathogen samples and genetic data are shared and how resulting benefits, including vaccines, diagnostics, and treatments, are distributed, efforts are bound to be futile in managing global health emergencies.
So we thought and we considered it that should be added to the pandemic agreement.
Shedding the picture on African countries during the COVID-19 pandemic, Mpox, and Ebola, despite their contribution in providing critical data and samples, they faced delayed and limited access to vaccines, diagnostics, and treatment, hence a devastating health response, calling for an urgent need for a fair and accountable global framework.
Ebola comes in Uganda, but then the products of Ebola are somewhere in one of the developed countries. They are holding the vaccines, they are holding the diagnostics, and we are still into that process of begging. So for them, they keep them for profit, and for us, we need them to save lives.
The access should not have conditions. Fully, it should not have conditions, like, as I said, registration, like, as I said, sharing the vaccine. There are those that are saying, I think, should be two-way. There is where you can readily access the samples without necessarily going into the condition of sharing technologies, sharing the technical knowledge.
According to Diana Mwesigwa, heavy reliance on imported vaccines and pharmaceuticals limits manufacturing capacity and constrains access to essential health technologies, and without robust benefit-sharing mechanisms, efforts to strengthen regional production and achieve health sovereignty will remain unattainable.
But from the lessons like I've shared from the recent pandemic, especially COVID, is that we need to be assured of what exactly we should have when a pandemic falls. Falling short of that, it means that we are going to go back to history. Like, this problem will be cyclic in nature. It will never end. We will be in begging, people dying and all that.
They are therefore advocating for enforceable benefit sharing, standardized contracts, and support for a pro-public health approach, among others.
We should be assured of 20%, from the products that have been made. That 20% of those 10% of the product should be provided through donation, and then the 10% should be at a reduced cost to the WHO, for them to be able to distribute to the poor countries.